Hi, welcome to Fertility Talks Live. This is my live post number 135, and we're going to talk about the ticking biological clock and fertility and what you can do. So, before we go on into the meat of this, I want to thank you for being here. And if this is your first time joining in, I just want to tell you a little bit about what this is. So, I am the founder of Alive Holistic Health Clinic. And I am the author of Pathways to Pregnancy because, as a professional in the field, as well as a person who struggled with fertility, I really wanted to create hope and good quality information out there. So, this is why I wrote my book, Pathways to Pregnancy, and this is what came out of it. I wanted to create a free space where I can interview people, awesome people like Dr. Sadhna Singh, who I have with me today, and to provide you accurate information, advice that is grounded in by research and experts' experiences as well as personal experiences. So thank you again for being here, and I hope you'll find this insightful and hopeful and providing you choice and empowering you with choice. So before we start and go into the meat of this, I'm just going to share with you a little bio about Dr. Singh. So she's been practicing medicine, well, initially medicine, Western medicine in India and Singapore for over 10 years. And it's in the field of gynecology, internal medicine, and emergency medicine. But then Dr. Singh had special interest in integrating an integrative medicine, which drew her into the field of traditional Chinese medicine. And then she completed her master's in acupuncture and traditional herbal medicine. And then she pursued a doctorate at ACTCM in San Francisco, specializing in gynecology and infertility. So her unique education and experience in both Western and Eastern medicine translates her into clinical practice as comprehensive and integrative patient care. So thank you again for taking time out. And I know you just finished a busy day at work, and I did too. Just come on over here, and then we're providing information and hope for others. So thank you.
Well, thank you, Mary, for the introduction, kind introduction. I've known Mary for more than 15 years, and I think this is such an excellent project you're working on with offering education on this sensitive topic. And I think you've had over 100 posts. This is what you said, number 135.
Yeah.
Just to add a little on the integrative medicine angle, I just wanted to mention have been actively involved with ASRM, which is the American Society of Reproductive Medicine, in creating what is the complementary integrative medicine special interest group. Similar as your platform here for our patients watching or women who are interested in fertility watching, that is providing a very niche sort of education for reproductive endocrinologists, nurses, embryologists at the ASRM, where we've been holding some scientific session and roundtables.
I love that.
Another brief mention I wanted to say about with the American Board of Reproductive Medicine, Oriental Reproductive Medicine, that you and I are both fellows, and I've been excited to sort of be part of it from the very inception. But that provides a great resource for referral for our viewers who may be not in Houston, where I am, or not in Toronto, where you are, but it provides an excellent source of specialized practitioners who are focusing more on gynecology, women's health.
Really thank you for adding that in. So important for people from all over to have the resource and get the help that they need. And definitely with experts in the field and having the knowledge both of Western and Eastern medicine. So yeah, thanks for adding that in.
So leads us to our topic of the day, which is, I guess, an important question nowadays with modern fertility, basically saying how we have the biological clock ticking. Tick tock is on all the time. With specifically, biological clock would have referred to more chronological, like our circadian rhythms, but now it's just the name biological clock is synonymous almost with fertility. And then we are faced with, okay, what do we do if this clock is ticking? So let's look at some of our topics we sort of briefly discussed earlier, we'll talk about today, is that I would started with a question like, do our eggs have an expiry date? So do they expire? And the answer to that would be, this is a true statement. They do have an expiration date. So we age, the eggs age. So also not only that they age, but they are a fewer number. So we are born with, say, 1 million eggs. By puberty, they go down, goes down to almost like a 2.5% of where we started, almost 25,000. So basically, women, when they are past 35, which is counted nowadays as advanced maternal age, they're already dealing with a smaller pool of eggs. So it's the quantity is less, and at the same time, the quality is also affected. So as we age, the quality of the eggs also is affected, and which gives rise to problems such as there may be an abnormal number of chromosomes, and there may be a higher chance of having genetic issues, chromosomal problems, and a higher incidence of miscarriages. So basically, the take home from it would be that this is applicable as lower quantity and lower quality once a woman passes the age 35, and more so with our patients we see over 40, or once they're past 40, more like, which would encompass a lot of the patients we see, and mostly in our clinic, as you would agree, probably we see most of the advanced maternal age patients.
But then, so, you're saying this, then, what can we do? Because really, I don't believe that it's finite. Like, yes, there's a finite number, perhaps, but we talk about the ability to enhance the eggs and the quality, right? So I don't think it's so linear, like, okay, you're 35, bang, you're going to have crappy eggs, right?
Exactly. I totally agree with you. It's not as if it's a finite and more like a what we call a life sentence for fertility, that you're 35 and that's it. Because what I was just trying to point out was the facts as per Western medicine, that this is just to be cognizant of it, so that people who are watching or listening, and if they have been planning, then they need to move a bit faster on that process and combine other modalities such as acupuncture, herbal medicine, dietary changes, supplements, lifestyle changes, de-stress, things, as you rightly mentioned, can to a certain extent improve their chances.
That's right. So then let's talk a bit about that, right? And the first thing that you mentioned, of course, is the acupuncture. I've covered it somewhat in other talks, but I don't think it's not old, because every time they come to the clinic is, what more can I do, right? So
Right.
let's delve more in depth as to, well, why acupuncture? Why herbal medicine?
Well, looking at it from a traditional Chinese medicine perspective, as I had mentioned about the whole emphasis on the numbers and the quality decreasing, that translates into our very essence, our very jing that we are born with. It starts to deplete over the years. And at the same time, a certain number of utilizing your overstressing, using too much of the chi energy, all that gets depleted. So with the acupuncture, with the herbal medicine, we can help balance our patients, balance them at a place better for optimizing their own fertility if they're going the natural route, and also to improve their chances for assisted reproductive technology. They may be opting for doing insemination, IUIs, or intrauterine insemination, or IVF. And if they are working ahead of time of being cognizant of the fact that they need to do what they can to try and optimize, then it's all going to come together as a more successful outcome and prepare their body, which brings us to the whole pre-pregnancy planning.
Great. So let's go straight into that. And because really, there is research, and it's been documented for about a decade or more now, right? With regards to some people out there that are watching might be familiar with the acupuncture that is done right around embryo transfer for in vitro fertilization. But now there's more and more research that's looking at doing acupuncture before the IVF. So can you speak to that then, and then go into the pre-pregnancy prep?
Right, definitely. I mean, for lack of a better analogy, it's something like when we are planting putting a plant in the soil, we want to prepare the soil better, right? Because if we have the soil better prepared, we have a better chance of a better plant outcome, beautiful flowers or good fruit. On a similar way, if we prepare the body better, which would go back to about 3 to 4 months before they even start trying to conceive. So this is based on a Western model of folliculogenesis, or these follicles or eggs in our body responding, say from 3 months, it takes that time frame for them to be improving on the response. So whether they add supplements, whether they're adding acupuncture, whether they are planning an IVF, and to help make that process more successful, even though we have more research around the transfer time just for pre and post transfer acupuncture, that does allude to the fact that it is successful when IVF outcomes are better with acupuncture as pre and post transfer. But that's just one part of it, just one component. It's almost like a just adding it at the very last. So knowing that it can help at that last transfer moment, applying the same to the 2 or 3 months ahead to prepare them, it's definitely a more recommended form. That if ideally, if we had patients who'd asked us when do they start treatments, I would recommend 3 to 4 months ahead of time.
Yeah, yeah, and we all do in our field, because again, as Dr. Singh mentioned, it's really now focusing on the actual egg quality versus around transfer, where really we're focusing on the uterus. It does not touch the embryos that have already been developed, right? So we can't do anything with that. It's already done. It's a done deal. So then yes, we can help what I call make the uterus juicy, make it more receptive and relaxed, but it can't do much with the embryo that has already been created. And so we want to go further and take it back 3, 4 months, and gosh, if you have it 6 months, for Pete's sake, the longer the better. And but I know most people are like, no, I'm gonna be trying every month. Right? They don't want to wait, and it's like, because the time clock is ticking.
Exactly.
So, right? And
Yeah,
but ideal.
agree with you, just because also most transfers have now moved to the frozen embryo transfer, so it's not fresh transfers as we used to see 15, 20 years ago, in which also, yes, even if they're doing a fresh transfer, when you're jumping in that very last minute for just an acupuncture treatment before after, you're helping the uterus, you're helping reduce the contractility in the uterus, improving some blood flow, working on some de-stress. All of these are positive, but at the same time, not had a chance to work on the eggs or the embryos.
Mm-hmm. Yeah. So then, to be very specific, if a woman has the time, what is your exact recommendation? When do they start acupuncture, and how frequent?
I would start 3 months ahead. 3 to 4 would be ideal, but 3 months, and weekly acupuncture is what I would recommend in our practice.
Sorry, what did you say about acupuncture?
Once a week for the
Oh, once a
acupuncture
week. Okay.
treatments, and a lot of them in our practice would also take herbal medicine with it, and these herbs again would be something that would help balance, as they are more of a gradual process. It's not a quick fix. It's not something you'll be trying to nourish from within, trying to tonify the yin, tonify the chi. It takes time. So we do recommend doing the herbs then, because as and when the patients start anything on stimulation medication and gonadotropins, then we have them discontinue the herbs.
Yes, yes. And in fact, lots of doctors will say, if you can continue with the acupuncture, but when it comes time to herbs, maybe just stop right when we start the stimulation hormones.
Right.
Although I don't know if you get this, but sometimes in those cases where they've had multiple failed IVFs and they, throw their hands in the air and say, okay, fine, do whatever the heck Mary tells you. So then we start doing some herbal medicine even in those IVF processes, because in China, they often do have it concurrently with the IVF stimulation drugs.
Right. I agree with you. We have those two where it would be like, okay, whatever you want to do along with. And we may not be doing herbs at that given time for stimulation because gonadotropins are doing their job, but the patient may have some insomnia. They may not be
Exactly.
sleeping well. And when they're not sleeping well, that's translating a lot or changing a lot on the cortisol levels and what may have on their endocrine system. So if we can even provide them herbs to help them sleep better, or if they're having a lot of headaches as a result of their estrogen levels going up, how we can manage that with our acupuncture or herbs, then we can do combine that for assisting their
Yes.
process for
Yes.
stimulation.
Absolutely. And I just want to add in there, because I know for you and your clinic, and you do it once a week, and depending on the scenario. So, for example, like polycystic ovaries or stubborn cases of endometriosis, sometimes we actually increase the dosing of the acupuncture. So that for them, maybe twice a week. And sometimes, let's say if there's a low antral follicle count, at the time of IVF, we say, oh my gosh, maybe this is the time where we can do even successive acupuncture treatments in a row, and typically using electrostimulation. So it becomes, instead of the cookie cutter approach, we really individualize what is beneficial for the person and their scenario and their health history. And like I say, their antral follicle count, meaning the number of eggs that are within the structure called follicles at the time of starting an IVF cycle. Because as we know, if you don't, the purpose of IVF is trying to increase the number of eggs that are retrieved at time of retrieval, right? So their Western science is working on quantity, trying to increase the number. And for us in Chinese medicine and acupuncture, we want to increase the quality. So if there is a lack of a number of follicles or lack of blood flow, for sure, if there's like the endometriosis component, and especially if you know that there's a lot of pain involved, then we might trigger you more.
Yeah, we would follow exactly a similar sort of a pattern for our patients who, as you mentioned rightly, with individually, if their requirement is that we're seeing there's, for example, too much of stagnation and there's too much of, other symptoms of pain or stagnation or phlegm that would require us to do more treatments. So even if they're able to make that time for it, that we would recommend twice a week. Also,
Yes.
for patients undergoing frozen embryo transfer, a lot of times we see that their lining is thin. The uterine lining may be thin because the body reacts differently to those exogenous estrogen versus when the body produces its own estrogen with the gonadotropin stimulation during a stimulated cycle. And in these, we even see them twice a week, sometimes even 3 times. It would all, again, like you said, that's the beauty of Chinese medicine, where we individualize it and there isn't the same approach for everybody.
Yes, yeah. So that's really great to add in. And thank you for that about the uterine lining as well, because some women do have those kinds of issues, right? Where the lining is not as substantial as they'd like to be. Because again, if you've not done IVF and if you are embarking on it, there's a minimum thickness of the lining before they say, okay, fine, we can do the transfer of the embryo back. And if it doesn't hit a certain level, like 8 millimeters, then they'll say, forget it, we're not going to do it. In the olden days, I think they were more lenient. I don't know about you in Texas, in Houston, but in Toronto for sure, if they don't hit 8 millimeters, they're like, forget it, we're going to cancel it, or we're going to just keep on going with the progesterone until we hit that.
Right, they have similar parameters here with wanting it above a 7, ideally an 8. So we have those 7.9 or 7.8. We're looking at a trilaminar pattern, which means a 3 triple layer, which would be showing that the uterus is receptive and then they may compromise on it a little bit, but ideally, yes, 8 or above, as you have the same as here. We do have, it reminds me of a patient I was seeing who had almost 4 or 5 months of different trials of all kinds of, things to improve blood flow, Viagra, and they had, other medications thrown in and nothing helped. And then once she started doing acupuncture for about 2 3 months for the next one, because it was one of those cases like, okay, do whatever else you can. And that particular cycle, by chance her lining definitely did better, whether it was combining a lot of other things also. And that's one thing with the acupuncture, that it's hard for us to really isolate it out as that one factor, or have those double blind randomized controlled studies to exactly demonstrate that, okay, it was just the acupuncture that did it.
Yeah, and you're right. And because really, who is going to do that? No woman that I would know, because they want to do everything they can to get it up there. So
especially
it's
when we're talking
multifaceted.
about especially when we're talking about the ticking clock.
Yes. Well, ticking clock and money ticking as well, because all
Exactly.
these procedures cost a lot of money, right?
Right,
So
right.
it's like we ought to optimize your chances, maximize the bucks that you're spending. So let's do everything: our diet, our change of lifestyle, our avoiding toxins or hormone disruptors, not all those kinds of things. So looking at
Exactly.
all of that.
Right.
Yeah.
So all of
So
that, as you mentioned, fits in very well with our pre-pregnancy planning. Say that 3 months ahead of time, if they have adequate amount of time to plan to take their prenatal vitamins, because we know folate is an essential element there for the neural tube development. Antioxidants would be something that they could add on, and then, as you mentioned about BPA, phthalates, just we know environmental disruptors that can mess with the endocrine system, to try and be cognizant of that, and giving it that time ahead, because sometimes we see patients, as you probably do in your practice too, who are starting their IVF medications in 10 days, and they ask you what all do they need to change on diet, environment, and change cosmetics, and my answer is nothing. Don't change anything right now.
exactly.
Just because, again, we are going back to that 3 month pre-planning stage is where we need to work with all of these, which would make a change on the epigenetics, make that environment around the follicle, the ovary, healthier, more blood flow, de-stress, better hormonal balance, to start with the process of whether it's naturally conceiving or IVF or IUI.
And that's really great. And then what I want to add to that is, for all those again watching, it's really individualized. So it's not necessarily let's do everything from to the moon and back,
The kitchen sink.
because right, because otherwise it can cause stress, and we don't want you to have more stress as you go through this. So really, you need to look deep within yourself and ask yourself, how much am I able to do? How much am I willing to do? And how much am I able to add on without causing too much stress, so that it causes anxiety? Because that's exactly what we don't want. We don't want to cause more anxiety.
Right.
So we look at not just the physical health, but also the emotional and the spiritual health, because it's all on the same continuum. If there's an imbalance in the physical realm, and you're doing everything from under the sun to help it, but then you're feeling completely neglected emotionally and spiritually, then I say you're actually off balance, right? So we
Right.
really need to check in and not forget that piece, because everybody's so focused on what else can I do physically, that they forget how to feed themselves, nourish themselves, as part of that nourishing the soil, right? Part of nourishing the soil is how you are feeling emotionally and spiritually.
Right. And that brings us to that complete mind body approach, where you're not ignoring one to just focus on the other. So, comes in our mental health professionals. At times, they do recommend them to see a therapist or a counselor who may be focusing more on fertility related work, or if they're already seeing somebody, encouraging them to go to the therapist more regularly, because this adds another level of stress with preparing for the IVF or preparing for that next step of conception. So preempting those changes, preempting how that's going to add to the stress. And that is such a great point you made there about doing everything that they are able to without causing more stress, you know.
And I
um,
love how you added, therapist, because at home you got to know that it's not about you doing it alone, and it's about really calling on a village that can help you get through it.
right,
So
right.
thank you for adding that in. Yeah.
That's
So I
definitely
think
part of it.
we're beating this to death for women, and I really don't want to walk away without addressing our male counterparts. So
That's as key as the clock in women, because as we know with fertility, we could have one third of the causes maybe just a female factor, one third causes could be male factor, so it's equally important. um, with the biological clock, of course, with males, it seems to be not as stringent as in the in female population, which we start to worry about 35, 40. It's a little bit later, more like 50, 55. And the main reason being, as physiologically our bodies age and change, everything is affected. We do see in even blood work for our male patients that testosterone levels are dropping, or their cortisol levels are changing, or their weight distribution is changing. All of those, which will impact hormones, would have an impact on the semen parameters.
that's right.
And there has been more and more research now with epigenetics for even sperm, and how that could be improved with adding supplements. So that is a factor that definitely is worth mentioning, because at times the focus stays just on our female patients. And we definitely want to bring it into light that there could be a male factor, especially if there is some unexplained issues where fertilization is not happening, repeated miscarriages are happening. We need to look a little further into the semen parameters, not just the semen analysis, but testing like DNA fragmentation, putting them also on some vitamins, supplements, antioxidants, and looking at their stressors and seeing they might have to come in for acupuncture at least about the 2 months ahead of time, because we know with that spermatogenesis process, it's about 80 to 90, again, about 80 days that we do need time to make a change.
Yeah, absolutely. And what I don't want to for not, sorry, I want to add in, because you already mentioned it, but I want to say it again because it's so important. When women miscarry, there's this automatic reaction. A woman will take it like it's their fault. And now we see through research that more and more has shown that the contribution to miscarriage is also through the male counterpart. So it's not just a woman's issue, right?
Right,
So I
right,
just want to drive that home, because emotionally, when a woman miscarries, it really feels like the onus is on them and that they're responsible for this
right.
mess, right?
Right, and that's so correct that you mentioned. That is a very important point you bring up. At the same time, there's also research to show when older men, the offsprings of them, they show as a higher some psychological problems, even
Right.
schizophrenia. There's a research to show that there's a higher incidence. So it's kind of it's almost being ignorant not to look at that factor, or because they're equally responsible to be definitely doing a good thorough check. And I encourage our patients to come in as a couple. It takes two, so even if they don't have anything else going on with male factor issues, it's nice for them to be supportive, to help their partner with the de-stress part, with even the nutrition being healthier for both of them would be, definitely positively affected by eating healthier, having a healthier lifestyle. Maybe even they might want to work out together. That would all contribute to better blood flow. And the working out reminds me about most of the times that you probably get from patients is also, how much can I work out, or when do I work out? Do I stop working out after I ovulate, because what if I miscarry because I work out? But I usually ask them to talk to their doctors and see what their doctors recommend. But on an overall, across the board, it would be like something that is keeping your heart rate in an optimal zone without it being a very strenuous workout. I usually recommend not to be preparing for any major, triathlon or doing something too intense. Just regular cardio and some light weights and nothing too intense on the working out.
Agreed. Yeah, and again, I don't want to forget this because I don't remember what number post. Because here's the deal, guys. Most of the people watching this are women, and I know as a woman trying to conceive, you're really doing all that you can to prepare. And here's what I also know: a lot of times, men are given the bill of good health, and then it does not give them any kind of motivation at all to change their lifestyle habits. And as a woman watching this, you're like seething inside. It's like, I'm doing so much, and why the heck can't you do something for me or for us? Like, let's optimize. So
Right.
for you in that place who is seething, or just want the partner to be there with you, right? Watch this post with Dr. Paul Turek, who is a urologist from California, I believe. Yes. And it's brilliant because I've had some patients, and Sadhna, if you haven't had patients watch this, get them to, if they're in the same boat, because it's made a difference. Because when it comes from a male urologist that specializes in fertility, the man listens to him.
Oh
It's
yeah,
so funny.
he's excellent. Yes,
Yeah.
definitely. Yeah.
Yeah, so it's brilliant because he will say, you know what? Even if there's nothing wrong and the doctors show you like your sperm count is great, and he'll say, just do it, just change your lifestyle, just do it for her. And it's made a difference. Coming from us might not make a difference, but coming from the urologist, it totally makes a difference.
Right. And definitely the idea of mentioning it here for the male factor is that also being affected by the biological clock is that if we are dealing with, or if a woman is concerned about her biological clock, then there is something that to be said about that they both need to be, going in for all the diagnoses, the lab tests, lab work, analyses to get a better plan of action. Is the numbers are enough for us to just try naturally, or does one have to combine it with an insemination, or is it that low that you got to go for IVF? So definitely that's something to be cognizant of and not ignore in the factor that they're trying to conceive. Yeah.
Absolutely. Thank you. I think we beat this topic to death, and it's awesome because I think we need to know about this. And if there's more information that you need, definitely contact either one of us. You know what? Maybe we'll post your link as well for your clinic, and you can reach out to me at marywong.life. And in fact, if you want to go and see all the other videos, if you go to marywong.life, go under the video section and just subscribe. It's YouTube. There's a YouTube channel, and so that's where the uploaded videos live. Because right now, as I say, it's live, right? And you can also check it out through my Facebook, but I think it's better to just go through the YouTube now. So right now, it doesn't look like there's many people on it, but there's lots of voyeurs because people don't like to be known, right? Because most part, people are private about their journey. So
Yeah.
this is a safe way. Yeah. So just subscribe discreetly and nobody will know. Okay, thank you, Dr. Singh, for being here, and hopefully we'll have you back again in the future, and we'll talk about something else fertility related.
Thank you for having me, Mary. It was a pleasure talking to you. And like you said, in case there's any questions, we can always try and answer them with, one could email or put a comment, and then we can try and, come up with the answers to what those questions. Yeah. All right. Thank you.
Last thing, the ABORM, which is the American Board of Oriental Reproductive Medicine, through that website, is there a place to contact? No, I guess not.
Yes, there is. The site is called aborm.org, and it has a list of practitioners worldwide, whether it's Canada, in the US, or New Zealand or Germany. And then the practitioners listed there, they do have their clinic information, and an email that if somebody wants to find a practitioner, a certain person they need to reach out to, they can go to that. Is that what you were
Awesome.
asking?
Yeah, that's definitely it. Okay. All right. We're going to have a good night. We're going to have a great chat next time, and we shall see you next time. Have a great evening. Have a great evening, Dr. Singh, and thank you again for being here. Thank you all for watching. Love you guys, and I'm so grateful to be able to do this, to offer you this to you. Okay? Take
Thank
care.
you.
Have a great night. Okay,
Bye.
bye.
Thanks. Good night. Thank you, Mary.